over to the Sydney Morning Herald, and again, it's like health is on the front page of the paper once again. Thousands of retired health staff have been called up. Tens of thousands of retired doctors, nurses, psychologists and even dentists have been asked to bolster their pandemic frontline as surging hospitalisations stretch health systems. And staff shortages hit critical workforces. Australia's medical watchdog yesterday doubled the number of practitioners on its pandemic sub-registers to more than 55,000 health professionals who have retired or stopped work but are now eligible to return to practice. It feels like Groundhog Day to me, Caleb, when it comes to how we're seeing each health department act in every state and territory in this country. I get to the sense that no one can cope even without COVID. Do you think this one has merit, the fact that they're being called up for retirement?
Well, I was about to say, I feel like every week on this program we have some front page talking about how, you know, we're behind and we don't have this ready and we didn't see this coming. How did we not see this coming? I mean, all of this stuff was entirely predictable, and we've had more than 18 months really now to get our act together, and seemingly we didn't do it because we were so fixated on this zero COVID business that when we got to zero COVID, it was like, well, COVID doesn't exist anymore. Reality check, it does, and we've learnt that in a big way, and we weren't prepared for it. We should have been prepared for this, and if it has come to the point that we have to ask people to come out of retirement, well, we've probably got no other choice, but we should never have got to that point in the first place.
Yeah, absolutely. Considering around the country and even federally, health takes up the majority of the budget pie. So I guess they're throwing all of this money at the problem, but I guess sustainability is what we need when it comes to health systems, not just money.
Yeah. And what do we get for our money? What do we get for our money? This is the thing. Well, I mean, it's once again, it's bureaucracy. The money is spent somewhere, obviously, and we are not seeing the results we should be seeing for that money.
Yeah, absolutely. Speaking of COVID zero, New South Wales voters are back and opening at 70% jabbed is what's on the front of the Sydney Morning Herald as well tomorrow. Almost 2/3 of New South Wales voters support the plan to reopen when the full vaccination rate hits 70%. As New South Wales prepares to emerge on Freedom Day, 17% of voters oppose easing restrictions, according to exclusive polling done by the Herald. This is great to hear because as someone that sits here in WA and has been told that I'm not going to get out of here until April next year or when we reach 90%, it's good that there is now a people's push to get vaccinated and let's get this COVID show on the road, because the sequel has been even worse than the original back in 2020.
Yes, thank Christ for that. And I hope that this is a message to other premiers around the country like Anastasia Palaszczuk and your man McGowan, that people want the country to reopen. We have had enough of this. We're sick of lockdowns. We're sick of not being able to visit our families interstate. We want life to go back to normal. If everyone's had the opportunity to get the jab, it's not my problem if they haven't done it. Let's reopen for business.
Amen, my friend, amen.